Now to your health and a disease that affects people of all ages. We're talking diabetes.
It's a disease that can be life-changing and difficult and literally takes a team of specialists to make sure the patient is living a healthy life.
Today we have two of those team members here from the Spectrum Health Medical Group, Dr. Gregory Dinas and Dr. Brian Buchanan. Thank you so much for being here today.
Thanks for having us.
Thanks.
You don't always hear about the team approach. What are we talking about when we say that?
Well, we look at the person with diabetes being the center of their team, and then you need the team members to help them out. And so very often that's their primary care doctor, a diabetes specialist or endocrinologist, a diabetes educator, and other support staff to help out with their daily needs for diabetes, and then also to help prevent complications and other problems, other specialists, including foot and ankle specialists and ophthalmologists and other specialists as needed.
And why is that? Is it because of how diabetes affects almost every single organ in your body?
That's it, exactly. One of the main complications of diabetes that are preventable are microvascular complications. So that's damage to the very small blood vessels and nerves throughout our body. Mm-hmm. So it affects every organ.
Yeah, it is interesting. My grandmother had diabetes and had poor circulation problems and had to really work within her diet. It is very big, and so it really makes sense to have this team approach. And so speaking of some of our limbs, you know, we talk about circulation and some different things that can happen to a person that has diabetes. Let's talk about our feet in particular. We have a picture here that we're going to kind of talk about.
Sure. So one of the biggest complications of diabetes is what we'll call neuropathy. Neuropathy is damage to the little nerves that affect the foot and ankle, and they become numb in the person's foot. Imagine if you put your shoe on and there's something in your shoe, you know it right now, you take the shoe off.
Yeah.
If you can't feel it, then it can rub in that site and could cause problems, and the skin can break down. So this picture shows two of the classic places that we see what we call a diabetic foot ulceration. And this is the biggest risk factor for an amputation, which is, for most people, the most serious complication that we can have, or the most feared complication from diabetes.
You know, Dr. Buchanan, it's really interesting because many of us wouldn't consider somebody who's a doctor of podiatry going hand in hand with someone who is managing diabetes, but it really makes such great sense when you talk about these problems that can develop, because you talk about those ulcerations, those can really cause some even longer term problems, like you mentioned, the potential for amputation.
Absolutely, and Greg and I work very well together along with other members of the team, and basically the patient comes in, they see Greg for management of their sugars, and then he sees something on their foot and he'll call me up and say, hey, can we get this person in? We'll see him right away and then treat it. And tell everyone that the best treatment is prevention, trying to prevent these problems. Once the foot wound starts, trying to heal it, although often is likely, it becomes much more difficult. If we can just prevent it from starting in the first place, which is just have to see the patients frequently, educate them, is really the way to treat this correctly.
Yeah, I was just speaking with a colleague of mine who said that they have a friend that was just diagnosed with diabetes in their 40s. What are really the symptoms, or what are things that are happening that we need to know that there might be a problem? Some risk factors or things that we're noticing that are different from our day-to-day life?
Sure. As far as to know if you may have diabetes, certainly if you're noticing increased thirst, having to go to the bathroom, urinate much more frequently, unexplained weight loss or weight gain, and a drop in your energy level, dramatically increased fatigue. Those are pretty non-specific things, but one of the things that you should talk to your doctor about is getting your blood sugar levels checked to make sure that that's not warning signs for diabetes.
Anytime really that you start to feel like something just isn't right.
Correct.
On a chronic or ongoing basis, really would be the time to call your doctor. And I love the approach that you take because you really are partners. We talked about the ulcerations. There are also some other concerns that have to deal with the feet that you are able to diagnose, Dr. Buchanan. I think we have another picture here, in fact.
Sure. So we look at really four things as being risk factors for problems in diabetic patients. One is the numbness or neuropathy. Two is the blood flow problems, or what we call peripheral arterial disease. Foot deformity, and there's a picture there of a large bunion and a hammer toe on the second toe. And as you can imagine, trying to fit this foot into a shoe, if someone has a numbness, is a recipe for disaster. concern.
Right.
So we try to educate them as far as, is this person a good candidate for surgical correction to prevent these things, or just a shoe accommodation or a pad to try to help prevent any kind of rubbing and blisters. So we try to look at the entire patient and try to figure out what's the best way to treat them.
So coming back full circle, the team approach is definitely something that can really look at all facets of what's happening in a person's life. We know that people are individuals and patients are all different. I'm sure that's something that is, huge in your day-to-day work.
Oh,
Absolutely.
Absolutely.
Yeah. The team approach has been proven to work in multiple studies, so
Yes.
we know that this is the real way to treat a diabetic patient.
So we talk about the team concept. Is how is it that you're able to collaborate with all these different fields of specialties?
Sure. We are very fortunate with our system at Spectrum in that all of the specialists and primary care doctors are connected via the same electronic record system. So when a patient comes in to see me and I ask them to take their shoes off as part of their exam, I can take a look at their feet, and if there's any identifiable problems, I have a way to very quickly and conveniently communicate with my partners that this person has additional needs and needs to be seen, and then Dr. Buchanan has all the information as soon as he sees the patient. So there's very little information lost.
Okay, and so we have contact information for both of you. If people have any questions, they can get in touch with you, all part of Spectrum Health Medical Group. Team approach here. Thank you so much for coming in.
Thank you.
This
Thank
affects
you.
so many people.
Absolutely.
More than
Right.
we know.
Absolutely. And Dr. Buchanan, I was able to interview you when I started my exercise program back in January, and I can say my foot is doing much better. Thank you very
Must
much
be
for all
magic.
your advice. I
You're
think so. Thank you.
We'll be right back.
This is 8 West.